Hello, everyone. This is our project on preventing diabetes in psychiatric patients. With this, we aim to reduce the burden on healthcare providers since we aim to monitor the risk of developing diabetes so that the patients do not have to go to the clinic every day. This is our team. We are the Healthckers. We are Saliso, a medicine student, and Eduardo and Carolina, biomedical engineering students. The problem that we are dealing with is that these patients have a higher risk of developing type 2 diabetes. And in fact, it often goes undiagnosed. Because of this, these patients require very frequent monitoring of their blood sugar levels, their weight, and their A1C levels. In fact, these patients have from 2 to 3 times a higher risk of developing diabetes than the general population, and even 10% of these patients have diabetes. 70% of these patients that have diabetes are often undiagnosed and they develop into very serious complications.
So basically, patients with psychiatric disorder require at least once a month the monitoring of blood sugar levels in order to avoid this development of diabetes. Our aim is to avoid these patients to go to the doctor to do this monitoring and do it with our app. This is going to reduce the burden of these doctor appointments for just monitoring blood sugar levels. And also, as some more patients are going to be able to access this technology, we are going to reduce the amount of patients developing diabetes. So this is going to reduce the future burden of these diabetic patients having to go to the hospital due to complications. Our proposal is to track the sugar levels of non-diabetic patients taking this kind of drugs, trying to monitor their risk of developing diabetes with customizing the blood testing schedule and giving them customized recommendations for improvement in their health and trying to reduce their risk of developing diabetes. So here, these are the factors that we are using to measure the risk of developing diabetes for a patient. We are getting gender, age, ethnicity, BMI, smoking, weekly activity, intake of carbs and fats, family history, and other diseases. And also, we are taking into account which psychiatric drugs are they taking that make this risk of diabetes higher. Here we have a table of which ones are giving higher risk of diabetes as a secondary option. And this is how we are gonna, once we calculate the risk, these are the different slots in which we're gonna classify the patients in low, moderate, high, and very high risk. And then in low risk, we're just gonna not give any recommendations. With moderate risk, we're gonna give these recommendations personalized depending on which they do in the registration. And then with high risk, we're gonna give them an increased frequency of blood tests. And then with very high frequency, very high risk, we're gonna make an appointment to the doctor because in this case they do need to go to the doctor. And then we're gonna present now our prototype.
Hello, everyone. I would now like to take us through the application we developed as a prototype for this idea. So the first thing is to register. For a user to register, he will need to provide his personal information. He will also need to specify whether any of his parents has diabetes, does he smoke, he or she smokes, and then the drugs that the patient is taking at the moment, and then his diet, some information about his exercise, how many days does he exercise in a week, and then is there any medical history he has in the past, and then he will need to specify his account information. So I will not fill this form because we have registered a user already. So I would now like to just log in with this user. So this is the homepage of the application. A user is not required to take the test every day, but there will be a recommended time for him to take the test. Then when the user clicks on his profile, there will be a health profile generated based on the provided information during registration. His BMI will be calculated and there will be an interpretation. Like in this case, the user has a healthy weight. Then there's a diabetes risk score, which was calculated, which was implemented based on research by my colleagues. And they also provided some interpretation for that. So with this, we can recommend specific interventions for the patient. The patient can also enter new data whenever it is recommended. He has a test, so he can use glucometer to check his random blood sugar or 2-hour postprandial. That would be much better. And then we can look at the trend over time. This is just a static data, but this is what is supposed to be. Well, this is what is supposed to be on the graph as the user continues to record his random blood sugar over time. For now, because of time factor, we have not implemented the recommendations. Thank you.